Debbie, is everyone that's supposed to be here? I don't believe few people are not here yet that I'm expecting.
This is the moderator. It doesn't look like I have Debbie back on quite yet, and it doesn't look like a couple board members that are marked that would be here yet. I don't know if you want to wait a couple minutes or go ahead and get started.
No, we'll wait a couple minutes.
Okay. This is the moderator. It looks like I have board member Chandler on, and can I get a quick mic check from you?
Hello.
Hello, we can hear you. Thank you.
All right. Is Debbie back on, Sarah?
Not quite yet. Let me see if I can reach out to her on Teams.
And can we get started without Debbie? I think she's also trying to join in. And can we get started without Debbie?
Yeah.
Okay. All right. We'll just get started. I believe we have as many as we have. So welcome to October 25th through 26th, 2022 board meeting. My name is Song Oh, president of the board. If everyone could turn on their cameras. And before we convene, I'd like to remind everyone present that the board is a consumer protection agency charged with administering and go ahead, Sarah.
Sorry, can I hit that record button real fast?
Oh yeah, sorry.
It's okay.
This meeting is being recorded.
Thank you.
Thanks. I'll just welcome to the October 25th through 26th, 2022 board meeting. My name is Sung Oh, president of the board. Before we convene, I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted consistent with the provisions of Government Code Section 11133. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 3 minutes to each individual providing comments. This approach is necessary to facilitate this meeting. Before we get started, I'd like to staff moderating the meeting to provide general instructions. Moderator?
This is the moderator. For public comment today, when public comment is requested, I will turn on the WebEx question and answer feature. Comments should be limited to the topic that is addressed in a specific agenda item. We will have instructions displayed on the screen each time, and members may click on the question mark typically in the lower right-hand corner of their WebEx screen, type in comment in the text box, and click send to be recognized. You may also choose to raise your hand by clicking the hand icon that is at the bottom row of your computer's WebEx screen, or if you're an audio-only participant, you can raise your hand by pressing *3 on your device. Each commenter will be invited to unmute themselves in turn, and each commenter will be given 3 minutes to speak with a 10-second warning. At the end of the time, their microphone will be muted, and we will then move on to the next individual who has requested for public comment. And that is all the instructions I have.
Thank you, Sarah. Before I take a roll call, I just want to welcome our new board members, Trevor Chandler and Karthik Jha, or KK Jha. Our newest members to the board. Trevor was appointed as a public member, and KK was appointed to the long-term care position. So welcome, although we can't, see each other in person, but we're not in person. We'll greet virtually. Welcome, welcome. All right, so with that, I'd like to take a roll call to establish a quorum. Members, as I call your name, please remember to open your line before speaking. Maria?
Licensee member present.
Thank you, Maria. Jake?
Licensee member present.
Thank you, Jake. Renee Barker?
Licensee member present.
Thank you, Renee. Indira Cameron Banks? Don't believe Indira is joining today. Trevor Chandler?
Public member present.
Thank you, Trevor. Jesse Crowley?
Licensee member present.
Thank you, Jesse. Jose Del Paz?
Public member present.
Thank you, Jose. KK John?
Licensee member present.
Thank you, KK. Kula Koenig? Steve, Kula was supposed to join, so we'll keep an eye out for the attendee to see if she can join us. Ricardo Sanchez?
Yeah, public member present, Ricardo.
Thank you, Ricardo. Nicole Tebow?
Licensee member present.
Thank you, Nicole. And Jason is not joining us, and I am here. Licensee member, the quorum has been established. Members, we have a full agenda for our meeting over the next 1.5 days. I truly appreciate everyone's time and commitment to the board and California consumers. I ask everyone participating today to be respectful of the work before the board today. We encourage participation by members of the public throughout our meetings at appropriate times. The board respectfully requests that when comments are provided, they are done so in a professional manner, consistent with how the board conducts its business. I'll now ask the moderator to open the line for individuals to provide the opportunity to provide public comment. You're not required to identify yourself, but may do so. As we open the lines, I'd like to remind everyone that the board cannot take action on these items except to decide whether to place an item for a future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather than an opportunity for members of the board and members of the public to request consideration of an item for future placement on an agenda, at which time discussion may occur. Moderator?
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment for items not on the agenda, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. It looks like we do have a request for comment from Mark Johnston. Mark, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you, board. My name is Mark Johnston. For the new members, many of you know me from serving the maximum 2 3-year terms on NABP's executive committee, a position I was elected to when I held the position of executive director at the Idaho State Board of Pharmacy. Today, I represent CVS Health. The board first discussed a new interpretation by the board's legal counsel at the 10/20/21 licensing committee meeting, whereby pharmacists are prohibited from working outside of the licensed space of a pharmacy, except for certain statutory allowances. The minutes reflect that Steve Gray challenged that the change in the definition of pharmacist in statute has allowed pharmacists to practice pharmacy from within or without a pharmacy since 2000. In the 1/19/22 minutes, it was reported that members of the public believe that no change in law is required, but these minutes also include the quote, statutory changes are required to expand remote processing provisions beyond those duties established in 4071.1. At the 1/22 full board meeting, a statutory proposal was developed, but quote from the minutes, some members suggested that the provisions to limit the remote functions to only being performed in California was too limiting, and noted that such a provision could negatively impact how some hospitals are currently operating. Public comment at this meeting supported this board member's dissenting view, touted remote work as helping burnout, and allowing a sector of the population to remain in the workforce. Additionally, the minutes reflect that overwhelmingly majority of the states allow remote work. Yet the board forged forward with a bill that would have imposed much regulation on activities that have reportedly occurred without incident for more than 2 decades, and certainly have been allowed during the pandemic via waiver without known incident. This bill failed. The waiver expires on 12/31 and the state of emergency will expire in February, yet the board has not discussed this topic again. I implore you to add this topic to your December meeting, extend the waiver until the end of the state of emergency, and ultimately reverse the interpretation that reverses 20 years of safe practice. The 4/26/22 Licensing Committee meeting minutes also favorably discussed remote work for technicians. But at a minimum, please don't stop California pharmacists from counseling their parents at the dinner table, holding brown bag events at community centers, balancing workload during these times of pharmacist shortage and illness, etc. I thank you for your time in the additional minute to 3 minutes. Thank you very much.
All right, this is the moderator. Our next individual who has requested public comment, Jeff Olson. Jeff, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
I would like to bring up an issue regarding Regulation 4071.1 that has exacerbated staffing shortages by restricting licensed technician and ancillary staff from performing data entry and non-discretionary tasks electronically outside of a licensed location. We're speaking about work from home or remote work. During the COVID pandemic emergency, our staff were able to perform duties at home under an emergency waiver, and this allowed our organization to continue to serve patients in need and protect our staff from spreading the COVID-19 virus. For 2 years, these staff members adjusted to their new daily lives at home, along with their family duties impacted by the pandemic as well, while continuing to successfully perform the same duties that they did at our licensed locations. Once the waiver is expired, once again, staff have to adjust their daily lives, and in some cases won't be able to return to work in pharmacy for various reasons, which will impact operation, and we are seeing the effects of that today. During COVID, staff loss was very minimal due to the flexibility of remote work. However, with the waiver expiration, we are already seeing increased staffing loss, and we're struggling to fill those positions statewide. There is currently a technician shortage in California, and from what I understand, across the nation, which also impacts our ability to find and fill positions with qualified candidates. Technology has changed in the last 40 years and outpaced our pharmacy regulations. COVID-19 taught us how vulnerable pharmacy is to widespread emergencies. We need to reinstate or make the provisions with a waiver permanent to ensure pharmacy has the flexibility to adjust to any emergency or industry need that will ensure patients continue to have access to care without delay. Thank you.
All right, this is the moderator. We'll move on to our next individual who has requested public comment. John Gray. John Gray, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hi, good afternoon. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. We would like to suggest that the board or one or more of its committees agendize a discussion of issues related to pharmacy personnel remote work. Specifically, there are 3 issues related to pharmacy personnel remote work that we believe warrant discussion by the board. First, the board sponsored AB 1379, which would have allowed pharmacist remote work to continue after the end of the state public health emergency did not pass during this year's session. Certainly, if the board wishes to revisit its interpretation of current law, as was suggested by Mark Johnston, that would be a welcome approach to consider. Otherwise, we recommend that the board engage in a discussion about whether it intends to seek an author for a similar bill for pharmacist remote work during the 2023 legislative session. Second, during the pharmacy technician listening sessions and pharmacy technician summit, some stakeholders voiced support for the board to seek statutory changes to allow pharmacy technicians to work remotely after the end of the public health emergency. We recommend that the board engage in a discussion about whether it should pursue statutory changes to allow for pharmacy technician remote work after the end of the state public health emergency. Finally, the current pharmacy remote processing waiver explicitly prohibits pharmacists from performing final product verification by remote processing. At the same time, we know that some Board of Pharmacy inspectors have claimed that pharmacists must physically touch a compounded sterile product when performing final product verification, even when an IV workload management system with image capture is being utilized to assist the pharmacist with product verification. This opinion is at odds with a recent study published by Stephanie Jean at the University of North Carolina, which demonstrated that with the use of an IV workload management system, there was no difference in the accuracy of checks performed by a pharmacist remotely versus at the product verification site. Therefore, we recommend that the board engage in a discussion about the conditions under which pharmacists may safely utilize IV workload management systems to perform remote product verification of compounded sterile products. So those are the three items related to pharmacist remote work that we recommend that the board agendize. Thank you very much for your consideration of these topics.
All right, this is the moderator. Appears that was our last individual who has requested public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you, Sarah. With that, members, anyone would like to say anything? Just please raise your hand or.
Hey, Sung, this is Jessie. I mean, I would be open to having a discussion at our next meeting. Is the December meeting too late? I can't remember the exact date that remote processing waiver expires.
I believe it's 30 days after the declared emergency period is over. So it's not December. Okay. Yeah.
I think it would be good to have a discussion and to add it as an agenda item.
Sounds good. Probably we'll go to licensing on that one.
Sounds good.
Okay. And then Maria, I think you were gonna say something.
I have nothing to add, just that it should be agendized. Thank you.
Okay. And Jake, I believe.
Yes, I'm in agreement that that should be agendized for the next licensing committee meeting and for full board, either one.
Okay. Any other thoughts before we move on? Okay. We'll move on to the next agenda item 3, recognition and celebration of pharmacists licensed in California for 40 years and other recognitions. As you may recall, several years ago, the board changed its recognition program for pharmacists and currently recognizes pharmacists that have been licensed for 40 or more years. This information is posted on our website, and pharmacists are provided with a certificate. Prior to transitioning to remote meetings, the board routinely provided an opportunity for pharmacists licensed for 40 years to attend the board meeting in person and be recognized by the board. Although we have returned to remote meetings, I would like to provide an opportunity for the board to recognize pharmacists that have been licensed in California for 40 years. Moderator, I'd like to open up the Q&A feature to allow any pharmacists if in attendance today that would like to be recognized by the board for 40 years of service as a California licensed pharmacist. Moderator?
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And I'll pause a moment to allow the public time to access those features and submit their requests.
I guess sadly nobody is in attendance or no one wants to be called out upon or congratulated. But again, thank you, Sarah. Congratulations to the everyone who has been a licensed pharmacist for over 40 years, or any pharmacist for that matter. Thank you. The board thanks you for your contribution to public health, and thank you for serving the Californians. Moving on to the next agenda item, for approval of board meeting minutes. Included in meeting materials are draft minutes for several meetings that have occurred since our July board meeting. We'll take them in order included on the agenda, and also a reminder, you don't have to abstain if you weren't at the meeting, but you could abstain if you choose so. Please just feel free to do that. And so we begin with first July 27th, 28, 2022 meeting. If anyone could make a motion to approve or any comments or changes needs to be made, please raise your hand. Thank you.
So I would like to make a motion.
Thank you, Jake. Jake makes a motion to approve July 27th.
second.
Thank you, Jose. I appreciate that. Any other comments before we go for the vote? Seeing none, we'll go for a vote. Maria, how do you vote?
Yes.
Thank you, Maria. Jake?
I apologize. I apologize for the interruption. Would you mind just opening up the motion for public comment, please? I apologize.
Oh, thank you, Ann. Sorry. We're going to open up public comment really quick.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And seeing none, would you like me to close that Q&A feature?
Yes, please. Thank you. Sorry about that. Going back to the vote, I think Maria, sorry, one more time.
Yes.
Jig?
Yes.
Thank you. Renee?
Yes.
Thank you. Trevor?
Abstain.
Thank you, Trevor. Jose?
Yes.
Thank you. KK?
Yes.
Thank you, KK. Kula? Kula's not here. Ricardo?
Yes.
Thank you, Ricardo. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Moving on to the next draft minutes for consideration are from August 25th, 2022 meeting. Any comments or anyone would like to make a motion to approve?
Hi, Song. This is Jesse. I'll move to approve those minutes.
Thank you, Jesse. Anyone second Jesse's motion?
I'll second it.
Thank you, Jose. Thank you. With that, public comment, please.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, Sarah. All right, we'll go for the votes. Maria?
Yes.
Thank you, Jake.
Yes.
Thank you, Renee.
Yes.
Thank you, Trevor.
Abstain.
Thank you, Jesse.
Yes.
Thank you, Jose.
Yes.
Thank you, KK.
Yes.
Thank you, Ricardo.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Moving on to the next draft minutes for our consideration are from September 14th, 2022 meeting. Again, members, I welcome your comments and would entertain a motion if you believe such action is appropriate. Members?
This is Nicole. I motion to approve the minutes.
Thank you, Nicole. Anyone second?
This is
Nicole?
Jig. I'll second it.
Thank you, Jig. Nicole motions, Jig seconds. With that, Sarah, if you could go to public comment, please.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And it looks like there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you. All right. With a motion and second and public comment, Maria, how do you vote?
Yes.
Thank you, Maria. Jake?
Yes.
Thank you, Renee.
Yes.
Thank you, Trevor.
Abstain.
Thank you, Trevor. Jesse?
Yes.
Thank you, Jose.
Yes.
Thank you, Jose and KK.
Yes.
Thank you, Ricardo.
Yes.
Thank you, Nicole.
Yes.
Thank you, Jason. Sorry, Jason's not here, and I vote yes, the motion passes. And for last consideration, this is draft minutes from September 21st, 2022 meeting. Appreciate all your comments and also entertain a motion to approve the minutes if you believe such action is appropriate. Members?
This is Renee. I'll approve to move those minutes.
Thank you, Renee. Renee motions. Anyone second? Renee's motion.
This is Jesse. I'll second it.
Thank you, Jesse. Renee motions, Jesse second, and then we'll go for public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And it looks like there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, Sarah. With that, we're going to go for a vote. Maria, how do you vote?
Yes.
Thank you, Maria. Jig?
Yes.
Thank you, Jig. Renee?
Yes.
Thank you, Renee. Trevor?
Abstain.
Thank you, Trevor. Jesse?
Yes.
Thank you, Jesse. Jose?
Yes.
Thank you, Jose. KK?
Yes, sorry.
Thank you. No worries. Ricardo?
Yes.
Thank you, Ricardo. Nicole?
Yes.
Thank you, Nicole. And I vote yes. The motion passes. All right, thank you for that. And members, we're moving on to the next agenda item 5, update from Department of Consumer Affairs. I would like to welcome Melissa Gear, the new Deputy Director of Board and Bureau Relations, to provide an update from the department. Hopefully, Melissa, you can have your camera on too so we can see you. Oh, there you are. Thank you. The floor is yours.
You're welcome. All right, thank you. Hello and good afternoon, everybody. I am Melissa Gear, the new Deputy Director for Board and Bureau Relations, and I am glad to see all of you. And before I get started, just wanted to also say welcome to our new board members, KK and Trevor. It's nice to see you and nice to meet you virtually. And with that, I will go ahead and get started with our DCA update. Please bear with me. I will be reading our updates, but let's get started. First, I just want to say thank you for this opportunity to provide the update. And I've kind of started with the first update, which is that I am here and available and excited to work with all of you. A little bit about myself is I started October 3rd. And I joined, I'm coming from the Department of Insurance, where I was the Chief Deputy Legislative Director. And I've been in that position since 2014. I've also served at the California State Teachers Retirement System, the California Attorney General's Office, and the Legislative Analyst's Office, as well as the Department of Education. So I bring a breadth of information with me, and I'm excited to use it all. Our next update is DCA Diversity, Equity, and Inclusion Steering Committee. Director Kimberly Kirkmeyer established the department's first Diversity, Equity, and Inclusion Steering Committee, or DEI committee, to guide the department in its equity strategy, initiatives, and action plans. The DEI committee will hold its official kickoff meeting November 9th, 2022. Strategic planning. In accordance with Governor Gavin Newsom's executive order, strategic plans in effect July 2023 and beyond must be developed or updated to more effectively advance equity and drive outcomes that increase opportunity for all. In response, DCA is revising its strategic planning process to incorporate more inclusive public engagement, data analysis, and embedding diversity, equity, and inclusion into the strategic planning process. Over the coming months, the DEI committee will inform the strategic planning processes. By March 2023, DCA will begin implementing the revised processes and working with the boards and updating existing strategic plans or developing new strategic plans. Next, we have the Our Promise campaign. It's that time of year again. DCA is excited to take part in Our Promise, California State Employees Giving at Work once more, and celebrate 65 years of caring for California. This year's Our Promise Vice Chair is Lourdes Castro Ramirez, Secretary of the Business, Consumer Services, and Housing Agency. And our DCA Our Promise co-chairs are our very own Chief Deputy Director, Christine Lawley, and me, Deputy Director Melissa Gear. The campaign began on October 1st and will end on December 31st. The campaign allows Californians to donate to a nonprofit or nonprofits of their choice. With your assistance, DCA hopes to continue its tradition of generosity and caring for our communities through this year's campaign. Please assist us in spreading the word and encouraging all members and staff to make a one-time donation or donate online through Cal Employee Connect. California can be cared for as little as $5 per month. In-person meeting guidelines and COVID-19 safety measures. Though legislation has passed allowing remote meetings through June 30th, 2023, we are reminding boards that choose to hold in-person meetings of the safety measures, best practices, and recommendations for holding public meetings. When planning for upcoming meetings, please remember all board, bureau members, and staff are expected to follow the state and local public health guidelines that apply in the area where meetings are held. California Department of Public Health released updated guidance for the use of face masks. Please refer to the guidance ahead of meetings to determine the appropriate masking approach for your meeting. If masks are recommended for your meeting location, please post face covering guidance signage at your meeting check-in or entrance. Board member travel. As travel begins to pick up, it is important to remember that state travel arrangements must be made through DCA's approved travel agency, Cal Travel Store, or Concur. All board, bureau members, and staff must use the most economical fares possible when traveling by air on official state business. Typically, this will be the Southwest Wanna Get Away option. However, there may be additional charges if changes are made to the flight. Flight changes to the date and time for personal convenience are not approved or justified reason, and the traveler will be responsible for any associated charges. Additionally, AB 1887 prohibits state agencies, departments, boards, authorities, and commissions from traveling to states that are subject to California's travel ban. There are now 23 prohibited states. On the website of the Attorney General, you can view the entire list of states. Last but not least, we have the partnership with the State Controller's Office. DCA will partner with the State's Controller's Office to share information with consumers and certain licensees about the Unclaimed Property Program. State law requires banks, insurance companies, corporations, and other entities to report and submit their customers' property to the SCO after a period of inactivity, generally 3 years. Certain DCA licensees will benefit from this partnership as it will educate them about their responsibility to report unclaimed property and assist with compliance. Additionally, the program is a great resource for all consumers to locate their unclaimed property. And as a side note, I will add that for myself and others, when we had this conversation in our staff meetings, there were quite a few of us that checked the site and did actually have some money to claim. So it's worth taking a look. And then lastly, I just close with, as always, DCA is here to help. And if there's anything we can do to assist, please reach out. And I am always here and available. So that's our DCA update. If there's any questions or comments, please feel free.
Thank you, Melissa. We appreciate it. And thank you for coming to the meeting. Members, do you have any questions or comments for Melissa?
This is Renee Barker, just to say welcome.
Thank you, Renee. Okay, any other comments? We're gonna go for public comments, Sarah.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll pause a moment to allow the public time to access these features and submit their requests. All right, and seeing no requests for comment, would you like me to close that Q&A panel?
Yes, please. Thank you, Sarah. Thank you again, Melissa, for very much for attending today and providing us with an update. I'm sure we'll see you soon again. All right, moving on to the next agenda item 6 is presentation on research underway on Senate Bill 159, from statutes of 2019 related to HIV pre-exposure and post-exposure prophylaxis. Members, as you may recall, Senate Bill 159 established authority for a pharmacist to complete specified trainings to independently initiate and furnish HIV PrEP and PEP. I'd like to welcome Ayako Miyashita Ochoa, co-director of UCLA Hub and Health Intervention Policy and Practice and co-director, Southern California HIV/AIDS Policy Research Center, and Dr. Laura Peckel, research director from UC Berkeley, to discuss the California Pharmacist Study. Thank you for joining, and the floor is yours. And I think hopefully we'll have the slides. There we go. Okay.
I can also share them from my my desktop as well, if that's okay for the board. Okay.
Absolutely.
Awesome. So pardon me, this is my first time on this platform, so if I appear a little bit clunky at this, it is because I am new to this technology, which I thought by now we would never have to say 2.5 years in, but here we are. So thank you so much for, thank you to the board for allowing us to come here today to share with you what we've been working on. I just want to make sure that you are all able to see the slides as I progress through them. So as I do with my students, a quick thumbs up would be helpful. I am so pleased to represent our team. We also are joined by two of my colleagues, Dr. Sally Raffi, as well as our research manager that is helping to run a big chunk of this study, Dr. Laura Peckel. I'm here representing the Southern California HIV/AIDS Policy Research Center. Our Policy Research Center is funded by the University of California Office of the President. We have two sister centers based out of both Northern California as well as across the state, affiliated with We the People, which is an initiative started by the Black AIDS Institute. Our policy research centers have been partnering for the last 9 months or so with members of CSHP, let me get the acronyms correct, as well as CPHA, to talk about the ways in which we could potentially study the impact of legislation, Senate Bill 159. So for those of you who are familiar with this particular bill, it was expanding access to pre-exposure prophylaxis in addition to post-exposure prophylaxis through pharmacists furnishing a medication. And along the way, as we were developing this project, we actually ended up collaborating with a new center at our law school here at UCLA, the Center on Reproductive Health, Law, and Policy. And so our team has grown over time, but I think that you'll find that what we're trying to study here is definitely relevant to everything that is happening across the state. And really, truly, our purpose in conducting this research study is to get a sense of where we are with regard to Senate Bill 159 and its implementation, to understand barriers and facilitators to the implementation of SB 159, but to also look at the delivery of sexual and reproductive health services out of pharmacies. Just want to confirm that you are all able to see my mixed method slide here. Okay, thank you so much. So we have two components here that are sort of part and parcel of this study. My colleague Laura Peckel is going to be speaking about the quantitative study, which is a large scale survey of pharmacists here across the state. My team here locally at UCLA is looking at conducting semi-structured interviews with about 30 or so pharmacists to understand better, again, those facilitators and barriers to the furnishing of pre-exposure prophylaxis, PEP, as well as hormonal contraception and medication abortion services. So our team is working on that qualitative side. We've got another team working on the quantitative side. And really, just to get here, it's taken us a bit of time. So, you know, as often happens in collaborative research projects like these, we really like to work with both content area experts as well as multidisciplinary, transdisciplinary researchers. So I come to you without a medical degree. I am a lawyer by trade. And so my expertise, in addition to the expertise of my colleagues who do have a medical background and who include pharmacists as well, we come here together for a better understanding across disciplines about this issue. So our timeline has led us to this point now where we are meeting you, Board of Pharmacy, after we have launched our study, in particular our quantitative survey that has gone out across the state. So it would be great to hear more from the board, whether or not this is something you might have seen across your airwaves. But for now, I'm going to go ahead and pass the baton over to my colleague, Laura Packel. Laura, if you're able to jump on here, that would be great. And I will take over the slides.
Hi, everyone. I just want to do a check to make sure you can hear me. Yes, great. Okay, well, thanks so much, Ayako, and thank you to the board for having us today. We're thrilled to be here to talk about the study that is currently in the field, actually, and we're happy to be here. So I'm going to talk a little bit more detail about the survey that Ayako mentioned. So next slide, please, Ayako. So I'll first say that the survey has been in the field for just over 2 weeks. And we have a phased recruitment strategy. And I'm going to talk about the quantitative piece here first. In phase 1, which we're currently in, we're actively recruiting practicing pharmacists from California professional organizations. And we're working really closely with the California Pharmacists Association and CHSP, and they're helping us with their membership base, sending out recruitment emails. And it's been actually beyond successful so far, just beyond our expectations. So we're very happy to have them as our partners. They've been really supportive of this work. The second phase, which is going to go into operation next week, is we're looking to recruit some students. So we wanted to get majority practicing pharmacists as the survey respondents, but we're also interested in the perceptions and knowledge and opinions of the pharmacy students as well. So we're going to be passing the recruitment materials through our contacts at the California-based schools of pharmacy starting in the next couple weeks or so. And we will also be expanding to recruit through social media. Once we've gotten through the next week, we were very careful about the first few weeks of recruitment, in part why we did this phased strategy, because we understand that if you put a survey online, you often get a lot of bots responding that aren't real people, particularly if there's an incentive attached to the survey. And we do have a $20 reward for completing the survey, in addition to weekly prize drawings and then a grand prize drawing at the end after the survey closes. Next slide, please. So as I mentioned, the main sources for our recruitment and outreach are through our partners at the professional organizations. And we have actually a large study team on which we do have several pharmacists. So they're helping us through their own networks as well to do some recruitments. And then also through the schools of pharmacy that will be starting that recruitment next week, as I mentioned. And we're using emails. Both the professional organizations have large databases of members that they've helped us send out emails to. As I mentioned, we're going to be working with them to post on their social media platforms starting next week. And then we have a few conferences. That the ACCP was just here in San Francisco about a week ago or so. So we had some recruitment materials there. And then CHSP has a conference, I think, down in Southern California coming up in the next week or two. And we'll be there as well, handing out recruitment flyers and information. And then the other just sort of standard recruitment methods, word of mouth, personal, connections that we have through our team. But I just will pause and say that through our professional organizations, we've already gotten over 600 valid responses to the survey, and our target is 1,000. And that's only after, just over 2 weeks of recruitment. So we're really thrilled. And we're hoping to be able to meet our goal of 1,000 relatively quickly. Next slide. So we do have a recruitment or packet or a media packet where this is a human subjects research. So all of our recruitment materials had to be approved by our institutional review boards. So we do have a packet of approved recruitment materials that we've been circulating to our partners who are helping us recruit. We have an set of email texts, and then we have a few different sets of social media posts as well. And then a link that you can attach to your personal email that links to the survey and as another avenue for recruitment as well. Next slide. And so we wanted to come to you all today to ask for your help with the recruitment. We wanted to talk to you about what we were doing and give you an overview of our current recruitment methods, but also say, are you willing to help us and do some of the following things that are listed here? Posting about the study in your personal social media platforms, in your professional social media platforms, just sending it out to your colleagues. Hey, there's this interesting study going on in California about expanding the role of pharmacists across the state. And then just using your connections that you have across California to help us get the word out about this survey. And I think that's where I'm going to turn it over to Dr. Raffi. Is that right?
Yes, actually, before we turn to Dr. Raffi, I just would like to highlight, Laura, I know that you've been looking at the data as it's coming in, and we've been seeing some trends in terms of who's completing this survey and what jurisdictions we're seeing representation from, what sort of demographic groups in terms of the pharmacists themselves, how do they identify and who's coming in there? Could you share with the Board of Pharmacy a little bit about what we're seeing in terms of trends?
Yeah, thank you I meant to bring that up, but so thank you for reminding me. So we are just, sort of real time looking at the demographics of folks who have responded to the survey. And we're like I said, we're beyond our expectations in terms of our rate of response, but we are really seeing majority of responses from the urban centers of California, so mostly Los Angeles and the San Francisco Bay Area. And we are seeing majority Asian and white racial and ethnic demographics coming in as well. So one thing that we wanted to ask for your help is to work with us on reaching pharmacists who work in more rural parts of the state, since we really want to make sure that we include the perspectives of those folks as well in the results of this survey, and then also reaching pharmacists, more pharmacists of color, Black pharmacists, Latino pharmacists as well. So if you all have thoughts or ideas on how we might reach those folks, we have a few things cooking. But if you have connections, if you know if there are professional groups that are focused on those populations, we'd love to hear from you about that. Thanks, Ayako.
Thanks, Laura. And I think that one of the really important pieces and the reasons why we're doing this is in part because there are folks like us that think the win is getting the law passed. And then there are folks out, working in the real world that know that that's just the beginning. So I'm really excited that our partner here, Dr. Raffi, is here to sort of talk us through what are the implications, what we think that these data will provide for us here in the state of California, and ways that we might think about analyses and dissemination down the road.
Hi, everyone. I'm Sally Raffi. I'm a pharmacist based in San Diego. I'm a pharmacist specialist at UC San Diego Health and founder of Birth Control Pharmacist, and working with the research team on this really important project. As Ayako mentioned, getting the policies passed and the protocols through is a great first step, but we are seeing gaps in implementation. It can mean delays in a pharmacy implementing these services or just not doing it altogether. my work, especially around hormonal contraception, but even more so, I think with PrEP and PEP and other services. So it's just, I think, very relevant for the Board of Pharmacy to be thinking about, while we're creating the scope of practice, is there any maybe responsibility for helping with implementation, or perhaps facilitating implementation by making resources available to licensees or to the public? Because a big part of implementation is not only getting our pharmacists and pharmacies to adopt these services, but also making the general public aware that it's even an option to go to the pharmacy, which we have seen has been a huge gap, even 6 years down the road for contraception, for example. So really looking forward to the results of this study. There have been other studies that have highlighted some of the implementation barriers, and would be great to discuss with, among the Board of Pharmacy and other stakeholders who may be on the meeting, how we might be able to actually take action on all of these research findings, because we keep doing the research. We know there's gaps. We see it also in the popular media when journalists are trying to access these services and can't find it in a local pharmacy. And so what's the next step? How do we actually change this? How do we get the training out to pharmacists, provide the implementation support, and make the general public more aware? I think that would all be great. For example, one of the things that I'm doing is working with the March of Dimes on a webinar tomorrow for pharmacists. It's free CE, and pharmacists can learn more about contraception and supporting healthy pregnancies, and also preventing preeclampsia, which is a really big part of maternal morbidity and mortality in the state. So that's the type of stuff that we have available.
So I just wanted to open up and for folks that might have any questions, obviously you all have procedures and protocols for how to do this piece, but I just want there to be an opportunity, if at all, for us to answer any questions you might have about this particular project.
Members, feel free to ask Ayako and go ahead, Trevor. Thank you.
Hi, thank you so much for your presentation. Really, really appreciate your work. And I had a couple of questions. First, regarding the demographics of the participants that you're hoping to get. One question I had was, are you asking for sexual orientation and gender identity as part of your demographic information? And what makeup of the LGBTQ community, how significantly have they participated in this survey so far?
Thank you, Trevor. That's a great question, and we are asking about that, but we're so early on in the survey results that we have not actually looked at that yet. But that's a great point, and we will start to look at that to make sure that to get an understanding of where we're at with that representation, and to make efforts to reach out to those communities if we're underrepresented. So I appreciate that. Thank you.
And just to clarify, our participants in this instance are all pharmacists. So that's also sort of a different way of looking at this, that we're really sort of trying to get the perspective of pharmacists first, and haven't yet gone to reach out to community members as of yet.
Yes, the intent of my question was to make sure, given that PEP and PrEP are so heavily focused in the LGBT community, that the pharmacists who do identify as LGBTQ will have a much greater, I imagine, education level and suggestions than someone who is not LGBTQ. So I'm excited to hear that you are collecting that data on which one of these pharmacists are LGBTQ, because I think my hunch is that they'll have a much higher standard of education versus the others, and I think they'll have a extremely valuable input for moving forward.
And it would be really helpful if we actually had like licensee data. We don't actually know what is the prevalence of pharmacists who identify as LGBTQ amongst our licensees. So we don't really know if we're getting a very representative sample or not.
Thank you for putting that on my radar. Now I have a new agenda item. The other question that I had was, I know that one of the main hurdles the pharmacists in general face, but especially with SB 159, is the reimbursement hurdle. And I was wondering, are you asking about reimbursements and how that impacts how pharmacists are engaging on this?
Yes, we are. We have several questions that ask about reimbursement. So hopefully we will have some specific data on that to help move things forward on that front.
On the qualitative front, we know, oh, sorry. I was just going to say on the qualitative front, we know that theoretically there are mechanisms for reimbursement, right? But practically speaking, do they really work? Do they work for the pharmacist? You know, in what way is it integrated into practice? Those are the kinds of questions we can get at through our qualitative interviews. So we're looking forward to gathering some of those data as well.
And we're asking not only about reimbursement for the drug costs, but also payment for pharmacist services. So we're capturing both.
Awesome, thank you. And my last question is in regards to, sorry, I had it written down here. I appreciate the fact that you had the tangible takeaways that you were hoping for this. And since California was really groundbreaking with SB 159 and really setting the standard, multiple other states have now moved beyond us and creating a permanent version of SB 159 without the limitations that our law currently has. Will your questions, the surveys that you currently have going out there, be asking about how this might change if those limitations were removed, whether it be the timeline limitations or the reimbursement limitations or anything like that, how that might impact how a pharmacist might look at participating in a program like this?
I want to invite Laura. I don't know if you want to talk about the discrete choice experiment component, because I know that's your expertise. I will say that I think that the qualitative interviews will give space for that conversation to happen in terms of whether or not there are changes that pharmacists could see take shape. I know that on the legislative front, that question is very much in the minds of some of the folks that are in Sacramento, and they're already looking at 159 again to see, are there additional amendments to be made to the law? The 60-day limit is a really big topic for a lot of folks, simply because that does come into play, especially when, folks are having trouble. The second piece that's connected to the 60-day, though, is the need for linkages. And that is to say that, even if you get your initial prescription through a pharmacist, that there needs to be some kind of connection to ongoing care. So that is something that I think folks recognize and certainly will likely be a part of those qualitative interviews.
Thank you.
Thank you, Trevor. Thank you for bringing up 60-day limit. I echo, that's definitely something that I wish that we could do something about. I'll go to Jesse next.
Thank you. I have a couple questions as well relating to demographics. Do you have information about the ethnic and racial demographics of pharmacists across California?
I just want to ask if you were part of our meeting earlier this week. We asked the same question, actually, and we haven't yet found the answer to that. In part, we started asking the question because we wanted to make sure we have a representative, somewhat representative sample, right? But I promise if we do find an answer to that, that will probably likely make it into our findings, just because I think that's an important component of understanding, the landscape.
Great, yeah, I would be curious because I would imagine that the majority of pharmacists in California are white and Asian. So I would be interested to see if that was actually accurately reflected. And then the other piece of that is whether the demographic survey is asking whether the pharmacist is fluent in another language and can help non-English speakers.
Yes, we are asking about other languages that they speak professionally as a pharmacist. So we are collecting that data as well. We haven't looked at it yet, but we are collecting it.
Great. Thank you.
Thank you, Jesse. Go to Nicole next.
Great. Thank you so much. I just wanted to say how excited I am to see that you all are doing this work. I work at the Los Angeles LGBT Center, and we were one of the co-sponsors on this bill. I spent a lot of time talking to people and explaining why it would be a good thing. I'm not surprised to hear you're not getting as much information from the rural areas, but I'm really hoping that once you do this, you can come back and do a presentation for us and tell us your findings. Because one of the big pushes on this is we were hoping it would expand access to rural areas where they might not have the same access that we have in LA and San Francisco and things like that. The one piece I wanted to bring up, and this is a kind of specific item, but there was a change in the reimbursement on the patient assistance plan on the manufacturer of the PrEP drugs that started earlier this year that is having a significantly negative impact on a lot of Ryan White HIV providers and our ability to provide PEP and PrEP to patients. So I'm wondering if your survey might be able to capture that as you're talking to people about reimbursement issues. I want to see how broad that issue is.
So I don't believe that we get into any of that in the quantitative survey. I would leave that for Laura to answer, but I think you raise a really important question in the scope of which we ask about sort of the types of reimbursements and whether there's been any policy changes recently that might be impacting them. I'll double check to see if that's included in our current interview guide, but I think that's a really great point. Generally speaking, our questions are broad and open so that folks that have any kind of, commentary about reimbursement can really, say what they need to say. So I'm hoping that we'll capture that, but that's a really good point. It's something that is happening on the landscape and that we should be paying attention to.
Great, thank you.
Thank you, Nicole. Any other member questions or comments? All right, seeing none, I really appreciate you guys for coming here and sharing much of the start of the study. We would welcome you back after the study's completed, hopefully soon, so we can learn. And also just for the minutes to reflect that Kula has joined us. Hi, Kula. And then also, as a public agency, the board provides opportunity for public comment on each agenda item. So we'll now be accepting public comments. If you could just open up for public comment. Public question is not a question and answer time, but you're welcome to respond to any comments about the study in general, but you're not required to do so. So just so you guys know, and members, if you'd like either presenter to respond to any public comments, you can request such a response as well. Moderator, please open the line for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And it looks like we have a request for comment from Mark Johnston. Mark, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you, Board. Mark Johnston with CVS Health again. I'd like to read from the minutes of 10/27/20. Mark Johnston, CVS Health, commented as part of the authority to furnish limited quantities of PrEP and PEP medications per 4052.02 and 4052.03, pharmacists to order HIV tests and provide these medications consistent with CDC guidelines. CDC guidelines recommend the following baseline values, which are also realized to be the standard of care: renal function tests, liver function tests, negative pregnancy tests, STI screening, and documented hepatitis B and C status. Mr. Johnston continued that 405202 and 405203 do not consider the ordering of these tests. He stated that 4052.11 provides ordering authority, which states that a pharmacist may order and interpret tasks for the purpose of monitoring and managing the efficacy and toxicity of drug therapies. Mr. Johnston inquired if the board could confirm that the ordering of these baseline lab values fits within the statutory requirement of being ordered for monitoring and managing of the efficacy and toxicity of these drug therapies, even though they would not occur prior to the furnishing of drug therapy. If so, CVS Health will initiate a rollout of its HIV prophylaxis furnishing program to the first of their 1,200 California locations. If not, CVS Health respectfully requests the board to fix the statutory conflict, delaying their program. The board did not agendize my request. However, they did say that the staff would work with me in getting an answer. After several inquiries, a year later, on September 14th, I was sent an email that said, "It is the board's belief that SB 159 did not provide pharmacists with the ability to order these tests." I have since then, in the last year, inquired and wanted to get on the agenda and asked the board if they were willing to address this issue. My most recent email was June 30th of this year, and I have not been allowed back on the agenda. So in summary, this is a circular statute. It requires us to follow CDC guidelines. CDC guidelines require us to order tests. We don't have the ability to order those tests in California. Therefore, we cannot participate legally in the HIV prophylaxis statutes that are in existence, and CVS has a program in other states that's operational. I would appreciate your attention to this detail after 2 years. Thank you very much.
All right, this is the moderator. It appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, Sarah. And presenters, if you'd like to say anything before you go, please feel free to do so.
Thank you so much for the opportunity. We look forward to coming back with some results to share.
Yep. Thanks so much, everyone. We appreciate it. Take care.
Thank you. Thank you, guys. And members, before we go, just want to make sure you guys don't have any comments. All right. So we look forward to learning more about this bill and looking forward to hearing about the study. Moving on to the next agenda item 7, discussion and consideration.
Hi, this is Eileen Smiley. I just wanted to ensure that the moderator promoted Gina Tomaselli. She is listed as one of the attendees, and she's also counsel to the board.
Thank you. Thank you, Eileen. Could just make sure Gina, our DCA reg attorney, is promoted, please. And so I'll get started. Discussion and consideration. Agenda item 7, discussion and consideration of adoption of board approved regulation Title 16 California Code of Regulations, section 1735.2, compounding self-assessment, including comments received. Members, the 45-day public comment period for the proposed amendments to section 1735.2 concluded on August 15th. One comment was received during the comment period. The comment received is included in the meeting materials along with a recommended response to the comment. I agree with the staff's proposed response, as I too believe the comment submitted refers to a different self-assessment form that is not currently undergoing a public comment period yet. I agree that no change to the proposed regulation is appropriate based on this comment. Members, I'd appreciate your thoughts on the matter, including the comment received. Also, I would also entertain a motion to adopt the regulation as noticed if you believe such action is appropriate. The meeting materials and meeting slide provide possible motion language. Members?
Hi, Sung. This is Maria.
Hi, Maria.
I'd like to move the motion as presented on the screen.
Thank you, Maria. Anyone second?
This is Renee. I can second that.
Thank you, Renee. With motion and second, any other member comment? Seeing none, we'll go to the public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you, Sarah. With a motion, a second, and public comment, we'll take a vote. Maria, how do you vote?
Yes.
Thank you, Maria. Jake, how do you vote?
Yes.
Thank you, Jake. Renee, how do you vote?
Yes.
Thank you, Renee. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Kula, how do you vote?
Yes.
Thank you. Ricardo, how do you vote?
Yes.
Thank you, Ricardo. Nicole, how do you vote?
Yes.
Thank you, Nicole. And I vote yes, the motion passes. Moving on to the next agenda item 8, discussion and consideration of changes to previously proposed text and reauthorization of a regular rulemaking to adopt a proposed regulation related to temporary license of military spouses and pay partners, California Code of Regulations, Section 1706.6. Members, during the July board meeting, members voted to initiate a rulemaking to establish the requirements for temporary licenses for military spouses and partners. As indicated in the meeting materials, following the board's approval, the department identified and is recommending additional changes to the language to provide clarification on the requirements related to the California practice standards and jurisprudence examination. The meeting materials include the proposed revisions, which are displayed as underlying text in the meeting materials. Members, do you have any questions or comments? If you're comfortable with the recommended changes, I would entertain a motion if you believe such action is appropriate.
I move the language on the screen.
Thank you, Trevor. Trevor motions. Anyone second Trevor's motion?
This is Jake. I'll second it.
Thank you, Jake. Jake seconds. With that, we're gonna go to public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Thank you, Sarah. With motion and second and public comment, we'll take a roll call vote. Maria, how do you vote?
Yes.
Thank you. Jake, how do you vote?
Yes.
Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Kula, how do you vote?
Yes.
Thank you. Ricardo, how do you vote?
Yes.
Thank you. Nicole, how do you vote?
Yes.
Thank you. And I vote yes, the motion passes. All right, we're moving along to the next agenda item 9, medication error reduction and workforce ad hoc committee report. Members, I'll now turn the meeting over to Nicole. But before I do, just want to make sure no one needs a quick break, like 10 minutes.
I could use a break song.
Okay, we'll take a 10-minute break. We'll come back at 2:55. We'll take a quick roll call to make sure everyone's back. It's 2:55. Maria, are you back?
Here.
Hi, Maria Jig.
I'm here.
Hi, Renee.
Here.
Hi, Renee. Trevor.
Here.
Hi, Trevor. Jesse.
Here.
Hi, Jesse. Jose.
Here.
Hi, Jose. KK.
I'm here.
Thank you. And Kula.
Here.
Thank you, Kula. Ricardo.
Here.
And thank you, Ricardo. Nicole.
Here.
Thank you, Nicole. And I am here. We are at 13. We just don't have a couple members, but we are getting big. So that's a good thing. So, all right. I will, with that, back to agenda item 9, medication error reduction and workforce ad hoc committee report. I will turn the meeting over to our chair of that committee, Nicole Thibault, to provide a report. Nicole, the floor is yours.
Thank you, President O. On behalf of the committee, I am pleased to provide the board with a summary of the committee's efforts at its meeting last month. Thank you to my fellow members, President O, Jesse Crowley, Kula Koenig, and Jig Patel. During our first two meetings, we focused on education of the issues around medication error and workforce challenges. We have received presentations from the Institute for Safe Medication Practices, the National Association of State Boards of Pharmacy on its Workforce Task Force report, the American Pharmacists Association on its Wellbeing Index and Fundamental Responsibilities and Rights, as well as a presentation by the Nova Scotia College of Pharmacists on the Nova Scotia Workplace Conditions Strategic Work. During our most recent meeting in September, we started evaluating policy issues to identify actions the board can take to improve patient care by reducing medication errors, starting with a review of the board's requirements for quality assurance programs. So our first agenda item today will be discussion and consideration of possible future changes to Title 16, California Code of Regulations, Section 1711, related to quality assurance programs. Members, California Code of Regulations, Section 1711, establishes the requirements for a pharmacy to establish or participate in an established quality assurance program. This program is to document and assess medication errors to determine the cause and an appropriate repose to improve the quality of pharmacy service and prevent errors. The requirements for a quality assurance program have been in place for 20 years, have remained largely unchanged, and are quite broad. As the committee continues to evaluate medication errors and workplace issues, review of the QA program requirements is appropriate. As has been reported both in the media and in public comments received, workforce strains are a contributing factor to medication errors. However, we have received comments that some staff are prohibited from including staffing and other workforce issues as part of their quality assurance reports. During our meeting, we considered several policy questions related to the QA program to determine if changes to the board's current regulation is appropriate. The questions and a summary of this discussion are in the meeting materials, so I will not go over it in tremendous detail. However, I will note that as a committee, we determined that changes to the board's regulations are appropriate to incorporate some mandatory elements. We have also identified the additional elements that should be incorporated into the regulation to refine the quality assurance process and facilitate a meaningful review of the error, which in turn should result in changes to prevent future errors more fully. At the conclusion of our discussion, we requested that staff draft proposed regulation changes to add several elements to the quality assurance report, including the date or date range of when the error occurred, staffing information, the type of error that occurred, workload information, and documentation of the actions taken. We will also be recommending that the current records retention period be extended. I would like to first ask any of my fellow committee members if they have any comments. Okay, seeing none. Other members of the board, do you have any questions or comments about the committee's work in this area? Oh, I think I see Maria's hand raised.
Thank you. I just wanted to make a quick comment that I'm glad that this is being discussed more, not only for the contents of the QA reports, but I think that maybe included in the committee's discussion is the quantity or the actual documentation of the error in a QA log. As part of our organizational development committees, Sung and I review citations that are attributed to different events. And very commonly, a consumer reports an error or errors reported, and there's nothing documented in the QA log. That is a huge issue, just that I'm not quite sure why, and perhaps that can be looked at also during your discussion.
Thank you, Maria. Yes, we'll take that into account. Anyone else? All right. Moderator, could you please open the line for public comment?
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. All right. Thank you very much. I'm looking forward to continuing our discussion next month. Our next agenda item, item B, is discussion and consideration of medication errors and possible future developments of medication error reporting requirements, including use of required standardized report. Members, during our meeting, we also discussed medication error reports. As indicated in the meeting materials, the reporting of medication errors is voluntary, and there are various sources that accept such reporting. The issue of medication errors is not new. A study referenced in the meeting materials back from 2003 concluded that dispensing errors were a problem at a national level, with about 4 errors per day in a pharmacy that filled 250 prescriptions. In addition, the New Hampshire State Board of Pharmacy reviewed medication errors it received between February 2007 and July 2012 and published its results that included 40% of the errors involved dispensing the incorrect medication, and 68% of the errors occurred when only one pharmacist was on duty. Limitations on the results included that the reporting of these errors was not mandatory. The practice of pharmacy has changed over the years. Such changes include pharmacies that may have integrated in technology in the dispensing process and expanded authorizations for pharmacists. More recent information published suggests that about 1.5% of all prescriptions in the community setting have a dispensing error. While that percentage sounds low, given the number of prescriptions dispensed in California, the estimated number of dispensing errors is staggeringly high. To consider whether the board should establish a requirement to report medication errors, we again considered a number of policy questions. The questions and a summary of the comments are included in the meeting materials. As a committee, we reached general consensus that the board should establish a requirement to report medication errors. The committee also indicated the need for some anonymity if the board pursues such a requirement. As a committee, we agreed that the board should not mandate use of a specific form. However, the board should provide a template that could be used as a guidelines for pharmacies. Questions remain about who should receive the report, the board or a third-party organization. The committee will continue its discussion during our meeting next month. Committee, before I open to the full board, do you have any other comments that you would like to share from our meeting? Okay, seeing none, I'm going to open it up to the full board. Does anyone have any questions or comments? Trevor.
Yeah, I was curious what the rationale was for recommending a template rather than having a required standardized form.
Sure. I'll try to summarize it briefly. There was a lot of discussion around this. The idea was that a form might be too prescriptive, especially given all of the different types of settings. That the form that works well for, say, a retail pharmacy may not work well for a hospital pharmacy, for someone with compounding versus someone who doesn't. And so we could offer a template which does not exist at current time as a baseline for people to use, but allow them the option to add more details if that is appropriate for their setting. Great. Any other questions, or was there anything I missed in that comment that anyone else wanted to add to? No? Okay. Y'all are making this easy. Moderator, can you please open the line for public comment?
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll pause a moment to allow the public time to access those features and submit their requests. All right, and seeing none, would you like me to close the Q&A panel?
Yes, please. Thank you. Okay, our next agenda item was the discussion and review of enforcement actions taken and enforcement authority exercised by other jurisdictions related to workplace conditions. Many of the issues and challenges in California are not unique. As such, during our meeting, we also considered enforcement authority exercised by other jurisdictions related to workplace conditions to learn about different approaches. Our committee had previously learned that in Nova Scotia, legal provisions required that pharmacy managers ensure the staffing plan of the pharmacy is commensurate with the needs of the patients of the pharmacy. Further, when staffing issues were related to errors, the board can require the pharmacy owners and managers to show proof of how they ensured that regulatory requirement has been met. There are several other jurisdictions within the U.S. that are evaluating workplace conditions, including some establishing requirements to report unsafe working conditions. Others have provisions to ensure sufficient personnel are scheduled to work. Some have notification requirements requiring a pharmacy to notify patients if the pharmacy is experiencing significant delays or cannot dispense prescriptions in a timely manner. In California, there are provisions establishing what can occur when a pharmacist is at lunch and requirements for a community chain pharmacy to ensure designated staff are available to assist a pharmacist when requested. Most recently, there is a new requirement establishing a prohibition on workload quotas. Including in the meeting materials are specific legal requirements for some other states which were reviewed and considered by the committee. Several states include a requirement for a pharmacy to ensure sufficient staffing. I do not believe California currently has such a requirement. During our meeting, members generally spoke in support of the authorities from other jurisdictions, including the provisions in Oklahoma. Members also liked provisions that limited the number of working hours for pharmacists, but noted that could be a challenge to implement because of variances in practice settings. We also considered the concept of establishing a staffing floor and considered who within a pharmacy should have the authority to establish appropriate staffing. Before our next meeting, I will be working with staff on a proposal for members to consider during our meeting in November. Committee members, is there anything else you would like to highlight from the meeting on this topic? Okay, seeing none, are there any questions or comments from the full board? No? Okay. Moderator, could you please open the line for public comment?
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, and seeing none, would you like me to close the Q&A panel?
Yes, thank you so much. Moving on to our next agenda item, D, discussion and consideration of just culture approach to managing patient medication errors and patient safety. Members, both during our committee meetings as well as during board meetings, we occasionally hear reference to just culture as a means of managing patient medication errors and patient safety. The Institute for Safe Medication Practices has some good information on just culture, including how a pharmacy organization can adopt such an approach. You will note from the meeting materials, a just culture is not a non-punitive or blame-free culture, but rather it is one focusing on the entire system to evaluate what occurred in an error and what future actions can be taken to prevent such errors from happening again. The meeting materials include some of the basic tenets. During our committee meeting, I shared some of the experience from my organization as we have transitioned to a just culture model. Adopting this model within our organization has led to identification of underlying contributing factors to errors, including, for example, software, computer issues. Just culture is about shared accountability for outcomes, and the transition takes time and resources, but it has resulted in a reduction in medication errors and improved patient outcomes. During our next meeting, we hope to have a presentation on just culture to learn more about it. Next item is agenda. Do I need to do comments on that piece, or do we not need to?
Yes, we should put it out to public comment if the members have comments.
Sure. So I'll start with the members. Committee members, did you have any comments? Okay, anyone on the full board? All right, and then moderator, if we can please open it up for public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. I'll pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. Okay, and our last agenda item is going to be E, the discussion and consideration of the Pharmacist Wellbeing Index State Report. Excuse me. As I mentioned earlier, our committee previously received a presentation from the pharmacist about the Pharmacist Wellbeing Index. As indicated in the meeting materials, a pharmacist at high risk of distress is at a twofold risk of a medication error, among other negative outcomes. During our meeting, we reviewed the most recent state report, which indicates a slight increase for California pharmacists. Included in attachment 2 is a copy of the most recent state report. As I did during our committee meeting, I also want to highlight that the updated pharmacy workplace and well-being reporting, which includes data from January 10th, 2022 to August 11th, 2022, included 14 positive experiences and 159 negative experiences. The negative submissions included categories focused on staffing and scheduling, workload and workload expectations, working conditions, and pharmacy metrics. Regrettably, as I reviewed the information, numerous pharmacists reported verbal or emotional harassment, physical harm, including by patients, and discrimination. Relating this information to the specific well-being index, individuals reported that these factors increased stress, increased burnout, weakened family and personal relationships, and lessened happiness. Committee members, do you have any additional comments on the well-being index? No? Okay. Full board, any comments, questions, concerns? No? Okay. Oh, Trevor, sorry.
I just wanted to note in reading the report that California was in the top 5 for the change in distress, for the largest increase in distress. Did you all discuss that at all, or what may be unique in California causing one of the largest increases in distress for California pharmacists?
We don't necessarily know the reason behind it, but I can share that we specifically, the Board of Pharmacy, put out a request for people telling them about the index. So we actually had a sharp increase in the number of people using it, which is great. And I hope people continue to. Let me plug that. But I think that might have contributed to our results. I think it was probably just that we got more data to some extent. KK.
Hi, good afternoon. In the comments section, I read that situation, at least described by public, is dire in the retail setting. So are we going to look at the root cause analysis for that to see what is causing the major well-being index deteriorating factors for the pharmacists, especially retail ones?
I'm going to, right now we're working on the things that I've outlined in this committee, but Anne, can you jump in? Do you have any insight into that?
So I think that some of the challenge, some of it I think is maybe driven by some of the negative experiences. And so for that piece, the Communication Public Education Committee is going to be working on maybe some kind of a consumer education campaign, talking about pharmacists, the critical role that they play, and hoping to maybe like lower the temperature a little bit with maybe some of those negative interactions. I think that there's also been some, maybe some negative interactions within the place of employment as well. So trying to like maybe, reflect on that a little bit and look for some opportunities to maybe engage a little bit more respectfully. With respect to the workforce, it's kind of a large picture. So there's different pieces happening in some of the different committees. So licensing, for example, you'll be hearing a little bit later about some of the work that they're doing specific to like maybe technicians, and then looking at that as a piece of the puzzle. So I don't think that there's a single answer. I think it's like looking at the comprehensive review of it. Some of it's happening in the different committees to then hopefully all of that will provide better tools for pharmacists to feel, maybe a little bit more in control and less distressed. I hope that's helpful.
Thank you. Thank you so much, Anne. You have the perspective of putting all the pieces together, so I appreciate that. And I can't say, KK, that I think this is all of it by any means, but it definitely seems like we're seeing some of that kind of negativity through and past COVID that we're hearing reported in a lot of industries. So I hope that helps. Jesse, did you have a question or comment?
Just a comment. If I remember correctly, and correct me if I'm wrong, Nicole, I think one of the things we did talk about was keeping an eye on this over time. I mean, it's not surprising to me as a retail pharmacist that the stress level does increase between August and September because you're starting to enter flu season. So the demand and the foot traffic in pharmacies significantly increases in the fall through the rest of the year. And so I'm curious, and I'm sure we'll get the information at later meeting dates to see how this changes throughout the fall and then towards the end of flu season to see if it tapers off at all.
Yes, that's a great point, Jesse. Yes, we are hoping to continue this data, and you're right. There probably is a seasonality to it. I bet in January when everyone has brand new insurance, everyone's feeling a little extra stress. So I would hope that the board will continue to send out reminders for people to do the well-being index. I think that's really great data, and the fact that we got so many more responses, if we can keep prompting that on a semi-routine basis, I think that would be super helpful. Great. Any other board member comments? All right, then we can go ahead and open it up for public comment, please.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, thank you so much. Okay, great. Anne mentioned it briefly in her response, but just want to flag that the Communication and Public Education Committee is going to be working on a campaign to educate the public about pharmacists. And thank you again to Kula for that recommendation. I'm very, very excited to see that. And President O, that concludes my report, and I will turn it back to you. Thank you.
Thank you, Nicole. Thank you for all the work you're doing. Really appreciate it. Okay, with that, we're moving on to the next agenda item, agenda item 10, Enforcement and Compounding Committee Report. I will now turn the meeting over to Maria Serpa for a report on the work of the Enforcement and Compounding Committee. Chair Serpa, the floor is yours.
Thank you, President O, and thank you everyone for sticking with us. If you've been with us since this morning's meeting, it's been a long day. I appreciate it. On behalf of the committee, I'm pleased to provide the board with a summary of the committee's work at its meetings this last quarter. Thank you to my fellow members, Vice Chair Jig Patel, Renee Barker, Indira Cameron Banks, Sung O, and Ricardo Sanchez. As indicated in the meeting materials, the committee has met twice since our last July board meeting. First item on the agenda, A, discussion and consideration of regulation of surgical clinics pursuant to Business and Professions Code 4190. The meeting materials include relevant sections of pharmacy law covering the regulation of surgical clinics, which are defined in Business and Profession Code section 4190. As specified in this section, a surgical clinic licensed by the board may purchase drugs at wholesale for administration from a commingled drug supply to patients registered for care at the clinic. Further, law specifies in Business and Professions Code 4192 that a surgical clinic is required to retain a consultant pharmacist to jointly approve policies and procedures used by the surgical clinic. Further, a consulting pharmacist is required to visit the clinic regularly and at least quarterly to review the operations and certify in writing if the clinic is operating in compliance with legal requirements. The written certification shall be kept on file in the clinic for 3 years and shall include recommended corrective actions if appropriate. The committee initiated its review of the board's regulation of surgical clinics during our August meeting. As a committee, we discussed several policy questions and ultimately provided direction to staff to draft a proposal for our consideration at our October meeting. During our October meeting, the committee reviewed inspection findings of surgical clinics, including the most frequently discussed items and orders of corrections issued. As a committee, we noted that the findings appear to support the need for further to refine the board's regulation of surgical clinics and development of a self-assessment process to facilitate compliance. The committee reviewed a draft statutory proposal, which is included in attachment 1. Hopefully you've all had a chance to review attachment 1. It's a really teeny writing there. As drafted, the proposal would update renewal requirements to include confirmation of compliance with quarterly inspections by the consultant pharmacist. Further, as a part of the renewal every odd number year, the renewal would also require the submission of the most recent self-assessment. The proposal would also establish a self-assessment process. As you can see on this meeting slide, hopefully you can see it, and in the meeting materials, the committee is recommending that the board pursue statutory changes to amend Business and Professions Code 4204 and 4192. Members, this is the committee's recommendation serving as a motion and second. Are there any members that wish to provide any comments or questions on this recommendation? So members, that's our recommendation. I don't see any hands. If I missed you, let me know. Okay, we're ready for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Please do. President O, having no comment, I will turn the matter over to you for the vote of the board.
Thank you, Chair Serpa. How do you vote?
Yes.
Thank you, Jake. How do you vote?
Yes.
Thank you, Jake. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Kula, how do you vote?
Yes.
Thank you. Ricardo, how do you vote?
Yes.
Thank you. Nicole, how do you vote?
Yes.
Thank you. And I vote yes. The motion passes. Back to you, Chair Serpa.
Thank you. Moving on to item B, discussion and consideration of potential draft regulations, including a self-assessment form related to outsourcing facilities. Earlier this year, in response to changes in the provisions for outsourcing facilities related to the authority to dispense patient-specific prescriptions under specified conditions, the board released FAQs providing guidance to the outsourcing facilities that intended to dispense patient-specific prescriptions in California. At the end of the FAQ is a link to the board's pharmacy self-assessment form that was to provide another tool for outsourcers to use to aid them in understanding the relevant provisions of pharmacy law related to the dispensing of medications that are required when dispensing patient-specific compounded preparations. During our consideration of the FAQs, it was suggested that the board develop regulations to more clearly define the requirements for outsourcing facilities when dispensing patient-specific compounded prescriptions. The committee started its discussion of this issue at our August meeting and included possible implementation of a self-assessment requirement. Following our initial discussion, staff refined the regulation language and drafted a self-assessment form for our consideration at our October meeting. As a committee, we noted it is important that the outsourcing facilities have a clear understanding of the requirements to operate within or into California, especially related to patient-specific requirements. Attachment 2, like that's attachment 2, kind of tiny. Hopefully you've all had a chance to read it because it's a little bit lengthy too. Includes the recommended regulation language and the self-assessment form approved by the committee. The meeting materials and the slide include the committee's recommendation. Again, the committee's recommendation serves as a motion and second, but are there any members that wish to provide any comments or questions to the discussion or to the recommendation? I don't see any hands up, but speak up if there are any that I've missed. Okay, I think we're ready for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Please do, thank you. President O, we have no public comment, so I turn the matter over to you for the vote.
Thank you, Chair Serpa. How do you vote again?
Yes.
Thank you, Jake Patel.
Yes.
Thank you, Renee.
Yes.
Thank you, Trevor.
Yes.
Thank you, Jesse.
Yes.
Thank you, Jose.
Yes.
Thank you, KK.
Yes.
Thank you, Kula.
Yes.
Thank you, Ricardo.
Yes.
Thank you, Nicole.
Yes.
Thank you. And I vote yes, the motion passes. Back to you.
Thank you, everyone. Item number C, discussion and consideration of proposed change to board citation and fine authority related to unlicensed activity. Members, relevant sections of pharmacy law are included in the meeting materials. These sections are related to the board's citation and fine authority. Most relevant to our discussion today is the board's current authority to issue a citation of up to $5,000 when the investigation reveals unlicensed activities. Committee members noted that the board's current authorized maximum fine does not appear sufficient to address unlicensed activities in some cases. The topic was discussed at both the August and October meetings. During the committee's initial discussion in August, members determined that the board's current maximum fine is not sufficient to address unlicensed activity and requested that staff draft a possible statutory proposal to increase the fine authority. At the October meeting, the committee members considered a possible statutory proposal. As a part of our discussion, we expressed concern that the patient risks associated with unlicensed activity include potential distribution of adulterated products. Attachment 3 includes the draft statutory proposal that's being recommended by the committee. You can see it on the screen. With the committee's recommendation serving as the motion and second, are there any members who wish to provide any comments or have any questions? Did I miss any raised hands?
Trevor's hand is raised, Chair Serpa.
Thank you, Trevor.
Thank you. I was just wondering about the rationale about it being $5,000 per violation. Was there discussion of it being higher or lower? Well, why not 10,000? Just wondering what the rationale was to come to that number.
Mm-hmm. Thank you for that excellent question. I think we were trying to stay in the same ballpark of what our other regulatory authority allows us in other sections, but I believe that Ann Sodergren could answer that more clearly. Ann, wasn't that our intent, was to be consistent?
Yeah, there's a provision in the law right now that allows for the board to assess a fine of $5,000 per occurrence for purchasing from an unlicensed source. So we are seeking to kind of mirror those provisions and concepts.
And will we, I don't know whether this is for Ann or for you, Maria, will we be monitoring or have some sort of analysis as to whether this change in fine structure has any demonstrable impact on deterrence or anything like that? Will we be tracking this in the event so we can have a kind of a quantitative analysis as to whether this particular level of fine is effective or how we need to change it one way or another?
That's a really good question. It is difficult to do anything really statistical, you know, to determine whether the deterrent aspect works. We do monitor enforcement statistics as to number and fine amounts, and those are reported periodically through the enforcement committee to the board. But Ann, anything to further add?
So on an annual basis, there is a presentation specific to the board citation and fine program. And so we break out, we could be breaking out the different authorities, and ideally there'll be a trending down if we secure this. So we'll be able to see whether or not it is having the desired effect.
Mm-hmm. Thank you. Any further questions from board members?
Yeah, I mean, and excuse me if you've already said this or you talked about this, but was there any discussion about the like different levels based on the type of action that was taken? Or is it like, yeah, was there a discussion around like different levels of fees?
So
or was that just too complicated?
No. As a reminder, the fine amount varies depending on the situation. And so the situation can merit up to a maximum of 5,000. Doesn't mean that we
Okay.
always use 5,000. That's the maximum. But we
Got it.
found that in many cases, the unlicensed activity is so egregious that $5,000 is just like a mosquito bite. You know, it's nothing.
Got it. Thanks.
Hey, Maria,
Jessie
this
had
is
her hands
Jessie.
ready. Oh, go ahead.
Thank you, Sung. I agree. I think 5,000 is way too low, to be honest. I also have some clarification. I guess what considered an occurrence? Because it says 5,000 for each occurrence. I'm just thinking of someone who's practicing as a pharmacist, for example. Is each occurrence considered each day they're working? Is it considered each prescription they're filling, or if they're doing consultation, performing immunizations? You know, there's so many different things. I wonder if we have like a clear definition of what that means.
So typically these cases, and Anne could be more clear, but typically these cases are unlicensed pharmacies sending medications into our state without our knowledge. And some of them have questionable practice activities. And so it's not just that they forgot to get a license or they let their license expire. There's other things that are going on as to why they are, financial considerations as to why they are sending medications into our state, potentially putting our citizens at risk. So that's the population that we're talking about. And I don't remember if we've ever had a citation against a specific pharmacist for unlicensed activity for out of state. Typically, it's the pharmacy, the ownership. Can you clarify?
Yeah, that's correct. It's for, like under the law, right, the non-resident pharmacies who we license, not necessarily the pharmacists themselves that are providing those services. Additional information on that at 11, because I think that they'll be talk about that later. But specific to your question about per occurrence, each occurrence. So in the case of an unlicensed pharmacy, that would be each prescription dispensed, because that activity in and of itself is what required the license that they didn't have. So that would be the per occurrence. How we currently use it now when someone's purchasing from an unlicensed source, like that pharmacy that's purchasing from an unlicensed source, that each occurrence is the invoice itself. That's the occurrence. That's the product that was received.
Got it. Okay, so then in the case of a facility, then you have the potential for this to really add up. I guess what will happen if this is a person or an individual license that's practicing, so whether that be like a technician giving consultations or someone who forgot to renew their license or had, something like that, what would occurrence be in that situation?
My understanding is that the unlicensed activity is the activity of providing a prescription. And I'm sorry, I cut you off.
Oh, no, that's okay. What I was going to say, Jessie, is that it's kind of like the same as any other type of, fine assessment. You're looking at the totality of the circumstances. What are the contributing factors? By law, we're also looking at, an individual's ability to pay and all of those things. So the law kind of details out some of the factors that through the regulation that staff need to be considering when determining a fine amount. So this creates a ceiling. It doesn't create a floor, right? So not every unlicensed activity citation is going to result in this kind of a fine. It becomes an option, but it doesn't become a mandate that every investigation results in this. It just creates an option.
Got it. Okay. With all of that makes a lot more sense. I still think 5,000 is too low for each incident or each occurrence. I guess as a follow-up, I know this is kind of modeled off some other language. Is there a possibility of getting the fine higher? Sorry if I missed that. There's just a lot of information to keep track of.
Well, I'm very pleased that you're willing to look at a higher number, but I think that what we're trying to do is to get something that would be statutorily approved. We don't want to shoot for something that's not going to be approved by the legislature or similar to what we currently have. But I am pleased to discuss, as we review the citation and fine program, whether maybe both of those areas, the maximum should be looked at being addressed. But that was the proposal of the committee, was to kind of match what we currently have with the hopes that it would be something that would be easily approved by the legislature.
Got it. Yeah, because I mean, truthfully, I feel like 5,000 should be a floor rather than a maximum. But
And sorry, just to quick question, Anne or Eileen, on that online pharmacy. I know that this is not thing to do with it. Just a question about what is the online pharmacy fine? Was it 25,000 per prescription? So something that we can, okay, something that we can think about too, as we go down the road.
well, if we already have something that has such a high fine associated with, like an online pharmacy, I would imagine would be similar to non-resident pharmacies. Could we model the fee based on that?
Jesse, we could try to, if you want to make a motion after, we could try a committee motion. And then, I mean, I guess if you want to try to make a motion on changing the amount, we could see where that lands as well. If you want to go that route, I would be open to supporting that.
Yeah, I would be, okay, I can make the motion to see if we can change the fine amount to the 25,000 or whatever it is for the online pharmacies to match that.
Currently, I guess, Sung, we have the committee's motion on the floor.
Right.
So we have to vote on that one first, right?
Right.
Sorry.
Right.
So I guess, Jesse, you would have to vote no in order for you to make another motion.
Okay.
Just a point of information, couldn't there be a motion to amend the current motion?
So that would be an Eileen, because we have to follow the actual legals, not necessarily Roberts, but Eileen.
Yeah, ordinarily, if this was like a motion not from the committee, then you could somebody could change what their motion was. In this case, because we have a committee motion, the committee's not meeting. I think we need to vote on it and also open it up for public comment too. We haven't done that yet, have we?
Not yet. Any other comments from board members? I'm not sure if we'll get any public comment, but that might make a difference to us too. Let's open up for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And it does look like we have a request for comment from Jazzy Gruwal. And Jazzy, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
And board members, can you hear me? Wonderful. Jassy Graywell here on behalf of the FCW Western States Council. I would really urge this board to reject this motion and accept a motion to increase the fines. We know from personal experience in the community pharmacy setting that $5,000 per retail establishment is very low, and in this case, it's per instance. I think giving the authority to the Board of Pharmacy to be able to increase that ceiling is extremely important when it comes to behavior that could be detrimental to the consumer and the public health. So I would really urge this board to increase that fine authority to really act as a deterrent. At the end of the day, this could be just the cost of doing business for illicit operators and factoring that in. And we really want to deter the behavior, not have them just pay a $5,000 to $10,000 penalty and continue to harm the public. So thank you for allowing me to make public comment. Urge you to reject this motion and accept a further motion. Thank you.
Thank you.
All right, this is the moderator. If there are no further requests for public comment, would you like me to close that Q&A panel?
Yes, thank you. Mr. President, before we go to the vote, I just wanted to make clear that the committee's motion is up to $5,000 per occurrence, so per prescription. So if we know that there have been 10 prescriptions sent into the state, we could fine them up to $50,000. So it's $5,000 per occurrence. And that's just a clarification. So, Mr. President, I think hearing public comment and committee comment or board members comment, we're ready for the vote.
Thank you, Chair Serpa. So this is this motion from the committee motion, and I'll start with you, Chair Serpa.
Yes.
Thank you, Jake.
Yes.
Thank you, Renee.
Yes.
Thank you, Renee. Trevor.
No.
Thank you, Trevor. Jesse.
No.
Thank you, Jesse. Jose.
Yes.
Thank you, Jose. KK.
Yes.
Thank you, KK. Kula.
No.
Thank you, Kula. Ricardo.
Yes.
Thank you, Ricardo. Nicole.
Yes.
Thank you, Nicole. I'm gonna vote no, but it does still pass. Just to confirm, now that this passed, is there an opportunity for another motion to see where 25,000 would land, or is that option now gone, Eileen? Just to confirm.
Because you voted for this one, I think if you wanted to, maybe add authority, you could probably do something else, but not to substitute it. You've already gotten a vote on this one that up to 5,000 was good. I think trying to change it with a different motion is overriding the board vote. Does that make sense?
Okay, so that's it then, right? We're moving on.
A question for Mr. President is, maybe suggest that we have further discussion on both those provisions so that we could look at them in the future for both the provision of purchasing from a unapproved resource and this one also for unlicensed activity of prescriptions coming into the state. I think further discussion would be warranted since the board was so divided.
Sounds good, absolutely. Thank you, Chair Serpa. So I'll hand it back to you.
Thank you. Agenda item D, discussion and consideration of enrolled or recently signed legislation impacting the practice of pharmacy. Members, as indicated in the meeting material, typically as a part of the October Enforcement and Compounding Committee, members consider recently signed legislation and discussion of implementation. Detailed in the meeting materials are the various measures considered by the committee. So let's see, is this the first one? Not yet. Is there a slide for the legislative activities? That's it. Okay, thank you. The first bill that we're going to talk about that was passed was Assembly Bill 852, was signed by the governor on September 25th, 2022. This measure makes several changes to the e-prescribing requirements in California. Changes include authority for pharmacies, pharmacists, and authorized practitioners to decline to dispense or furnish based on an electronic prescription submitted via software that does not meet specified requirements. The measure creates additional exemptions from electronic prescriptions as specified and exempts the prescription transfer requirements under specified conditions. In addition, it requires a prescriber to register with the board and the state they meet one or more of the specified criteria for the exemption. Such registration is required on an annual basis. Committee members noted agreement with staff recommendation for implementation. The implementation will include education on the changes as well as additional activities related to the online registration. Specifically related to online registration, staff suggests that implementation be substantially similar to the online registration process used for drug take-back locations or the board's health services registry. Staff propose that the online registry include the prescriber's name, license number, email address, and exemptions being claimed. Except for the email address, this information will be posted and available on the board's website. As annual registration is required, it is recommended that the annual registration occur consistent with the calendar year. The prescriber's email address will be used to facilitate a reminder. Members, do you have any questions or comments? And speak up because I can't see everybody's pic. Seeing none, let's go to public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And it does look like we have a request for comment from Lindsay Gullahorn. Lindsay, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Can everyone hear me?
Yes.
Oh, great. Thank you. Sorry. Good afternoon, President O, Chair Serpa, and board members. This is Lindsay Gullahorn with the California Retailers Association and the National Association of Chain Drugstores. Wanted to comment on AB 852 and request that the board potentially look into a specific provision of the bill and provide guidance on what constitutes a pharmacy's compliance with the bill. First and separately, just want to say that we are very supportive of the provisions in AB 852 related to the transfers of undispensed prescriptions and definitely appreciate the board's work on that part of the bill. Separate from those provisions, we have some concerns with Section 688B, which requires a pharmacy to accept prescriptions from any e-prescription vendor without first having time to work with new vendors and upgrade pharmacy systems to be compatible with the new e-prescribing vendors' software. Since the e-prescribing mandate went into effect at the beginning of this year, there have been instances where new e-prescribing software vendors have provided misleading information to physicians when marketing their e-prescribing platform. The problem with this manifests when the physicians who sign up for this new software use it to send prescriptions to pharmacies. Because this is a new vendor, the new e-prescribing software cannot speak to pharmacy systems because the pharmacies don't even know that that software exists. And there was no time nor requirement for pharmacies to make an arrangement with the new vendor to upgrade their systems, which actually could take months. So this puts pharmacies in a position where they can't comply with this part of AB 852. Understanding the law is already signed, we would just respectfully ask that the board maybe take a look at this part of the bill, just provide us with some direction on what constitutes compliance so that we are not in violation when the bill goes into effect next year. Thank you.
Thank you. I believe that some of the educational materials may touch on those topics. Any other comments?
This is the moderator. Appears there are no further requests for public comment. Would you like me to close the Q&A panel?
Please do. Thank you. The second bill that was recently signed is AB 2194, as approved by the governor on September 30th, 2022. This measure requires effective January 1st, 2024, pharmacists and pharmacy technicians must complete at least a 1-hour course on cultural competency during the 2 years preceding the renewal application period. Further, the measure would prohibit the board from renewing a pharmacist or pharmacy technician license unless the individual has completed the course. Committee members again noted agreement with the recommendations for implementation of the measure, including development of a system to establish a renewal process, incorporating a continuing education requirement for pharmacy technicians. As a part of the implementation, the board would need to establish a records retention period and mirror the requirements for pharmacists, which require maintenance of records for 4 years. In addition, staff suggested that implementation of the provisions include amendments to existing CCR section 1732.5 to update the renewal requirement for pharmacists. Also indicated in the meeting materials, the board previously recommended changes to 1732.5 to consolidate all CE-related requirements for pharmacists into a single regulation to assist pharmacists with compliance. Subsequent to that action, staff was advised that such an approach may not be appropriate. At that time, given that we had this pending legislation, it was recommended that the two issues be considered together if AB 2194 was enacted, and that's where we are now. The committee is suggesting that implementation activities be completed under the purview of the licensing committee. Staff will also evaluate the potential to update online and system-generated renewal notices to notify if updates can be made in advance of the effective date. Members, do you have any questions?
Yes.
Go ahead.
I'm sorry. Hi. Yes. Yes. Thank you. I'm excited to see this, and was curious if, as a board, whether the Board of Pharmacy has content ready to fulfill this continuing education requirement for pharmacists, or is this something we're going to need to put out a RFP for? How does that typically work when we add a new CE?
Anne, can you refer to that? I don't think this is required to be a CE that is administered by the board. It's a CE on cultural competence.
Yeah, so this does not need to be board provided, but it does need to meet the board's requirements for continuing education. So we kind of like specify the types of providers that can provide it, as opposed to some regulations that require board provided CE. This is not one of them. Sorry, that was a very circular way of saying that. I apologize.
And do we feel confident we have those providers to make this available?
So I do believe so. This was sponsored by the California Pharmacists Association. I'm happy to circle back with them, but we do have the delayed implementation as well to January of 2024.
Thank you.
Hi, this is Jessie. Following up on that, I don't know how to actually like make this or just make this a suggestion, but I would have the board consider providing this for pharmacists. Trevor is right. It is difficult to find pharmacists to provide cultural competency. I had to put a CE together a couple years ago. It was very difficult to even find the resources and the correct and proper resources to actually put that together. There were very few CEs available at that time. And so I think just for ease and also to adapt with the change in culture as we continue on, it would be a good thing to consider maybe having a board-sponsored CE available to people.
I think that's something that the licensing committee could consider. There are other CEs that are mandated that are available by outside resources. The only one that the board provides right now is a law CE, but they do accept that law CE from other people too, or other providers also. So I would suggest that the licensing committee just have that discussion and determine the steps moving forward. Anne or Eileen, is there anything other than that that we should suggest?
Hi, just Eileen. There's nothing I can think of. We can send it to licensing committee to take a look at, but I think there is probably more content being developed. It'll be interesting to see because some of the other boards, including a DCA and others, are going to have similar requirements. I know the California State Bar just rolled out some other CE requirements as well.
Just one last note. I've heard of other states having some sort of cultural competency CE requirement for pharmacists, but I'm not sure that they're as specific as this one, which is requiring the intersectionality with LGBTQ plus individuals. So that may be something that we can look into further as a licensing committee.
Thank you. Anne, were you going to add anything? I didn't want to cut her off. I think we're ready for You okay, Anne?
She's giving you a thumbs up. Sorry, Anne. Maria can't see you.
I can only see 3 people at a time. Otherwise, I can't do 3 things at once. Sorry. I think we're ready for public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll pause a moment to allow the public time to access the Q&A panel and submit their requests.
Okay,
Seeing none, would you like me to close that Q&A panel?
please do. Thank you. The third bill that we're going to discuss is Senate Bill 731, Criminal Records Relief. This bill was approved by the governor on September 29th. As you may recall from prior discussions, this measure expands automatic relief to include arrests for felonies punishable by state prison. Further, the measure would expand automatic relief to certain criminal felonies committed after January 1st, 2005 under specified conditions. During the committee's meeting, we briefly reviewed implementation activities, which include staff reviewing relief notifications to determine what, if any, actions is necessary, and working with the Attorney General's office to determine any potential impact on pending matters. Members, do you have any questions or comments? I don't see anybody, I don't think. I think we're ready for public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll pause a moment to allow the public time to access these features and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Thank you. Our next item is Senate Bill 872, Pharmacies and Mobile Units. This was chaptered on August 29th, 2022. During our committee meeting, members discussed the measure which allowed county, city, let me say that again because it's a little complicated. It allows a county, a city and county, or a special hospital authority to operate a mobile unit as an extension of the pharmacy license held. The measure authorizes the mobile unit to dispense prescription medications under specified conditions and requires notification to the board 30 days prior to commencing use, as well as 30 days prior to discontinuing use of a mobile unit. Committee noted agreement with staff recommendations to develop a standardized notification process. During prior board discussion, during prior board discussion of this measure, the board noted the need to develop FAQs and refer the development to the Communication and Public Education Committee. As a part of the Enforcement Committee's discussion, we recommend that the FAQs include, among other items, expectations on operational issues, including provisions for the pharmacist breaks and lunches, security of the mobile unit, both in use and when out of service, such as who maintains the keys and the notification process. Members, do you have any questions or comments or have any suggestions to add to the topics for FAQs? Hearing no comments from members, I think we're ready for public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access these features and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Thank you. E is Senate Bill 988, Compassionate Act, or Ryan's Law. Senate Bill 988 was approved by the governor on September 2nd, 2022. The measure repeals the requirement that a hospital manage a terminal patient's personal use of personal use of medical cannabis in the same manner of a Schedule 2 through 4 drug. This is something we talked a lot about last year, so this repeals that problematic comments. During our meeting, we noted that implementation is straightforward and will include education on the changes to the law in the board's newsletter, in our online resources, and in board-provided CE on pharmacy law. Members, do you have any comments or questions? Hearing none, we'll go to public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And seeing none, would you like me to close that Q&A panel?
Please do, thank you. Our last bill to discuss is Senate Bill 1346, Surplus Medication Collection and Distribution. This bill was approved by the governor on September 30th. This measure, which is related to surplus medication collection and distribution programs, extends or expands the entities that are eligible to donate medications to a county operating such a program. The measure also establishes pilot programs in specified counties to allow for the expansion of county-run programs. The measure requires the board to evaluate the pilot program and prepare a report to the legislature on January 1st, 2028. During our committee meeting, members expressed agreement with the implementation efforts detailed. The committee intends to receive updates on the pilot project and anticipates the first update will be provided in 2024, allowing time for recruitment of staff and to begin the evaluation process. I note that the implementation will also include education on changes in the law in the board's newsletter, our online resources, and in the board's provided CE on pharmacy law. Members, do you have any comments or questions? I think we're ready for public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And it looks like there are no requests for public comment. Would you like me to close that Q&A panel?
Please, thank you. The next agenda item is review and discussion of enforcement statistics. Attachment 4 includes enforcement statistics reflecting enforcement-related activities between July 1st and September 26, 2022. As indicated in the meeting materials, the board received 848 complaints during this period and closed 614 investigations. The board secured 2 interim suspension orders and 1 Penal Code 23 restriction. Also, as of September 26th, the board had 1,404 field investigations pending. The average days for various stages of the investigation process are included in the meeting materials. Members, do you have any questions or comments on the enforcement statistics? Seeing none, I think we're ready for public comment.
I apologize.
Maria, sorry, I have one question.
Sure, I'm sorry.
All good. I just wonder, as a new member, in future reports, it would be helpful for me, or for me at least, to see how this relates to previous years' numbers, because my only concern is I have nothing to compare it to as to whether or not it's an increase from previous years, or whether something is abnormal or not. So just a request for future ones, if possible.
Anne, can you refer to that? Because I thought we used to see that.
So typically we provide 3-year comparisons at the July board meeting at the end of the fiscal years. We do have the comparison stuff from the last couple of quarters with respect to the average, like, steps within the investigation stages, but it's typically the July board meeting where we provide the 3-year fiscal comparison.
Thank you.
But Trevor, I'm sure the staff would be happy to share with you any information that you're interested in, so that you don't have to wait until July. Quite a little wait there. Thank you. Any other board members? I think we're ready for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. And seeing none, would you like me to close that Q&A panel?
Please do. Thank you. President O, this concludes the report of the Enforcement and Compounding Committee. I turn the meeting back to you.
Thank you, Chair Serpa. Thank you, all the members. So that concludes the meeting, open meeting for today. I'd like to thank members of the public for your participation today. As indicated on the agenda, the board will now convene in closed session. Adjournment of the day will immediately follow closed session, and there will be no other items of business discussed. Members of the public, thank you for joining the meeting today. We will reconvene tomorrow at 9 a.m.